Welcome to our video training sessions for Surgery Connect. Surgery Connect is a cloud telephony solution, which means that you'll have no line capacity issues. Even if 100 patients were to call at once, every single one of them would be answered and nobody would receive the engaged tone. Each caller will go into the queue built specifically for your practice, and when in the queue, they will hear their queue position so they know how many people have got to be answered before they are. There's also the option of adding Queue Buster. It will also mean that there's no capacity limit on outbound calls, so if you need to make an outbound call, even when it's busy with inbound calls from patients, you'll always be able to do so. Through the user console, you'll have a real-time view of who's available on the system and whether they're available for a call. You'll also be able to see all the inbound and outbound calls through the practice, and there are also some efficiency statistics on that screen. If you're not interested in those, they can be removed. All calls are recorded, so both inbound and outbound calls are recorded regardless of the device that's used. The system's clever enough to send your calls to different phones depending on how you're working, and it doesn't matter where those calls end up, so long as they've come through Surgery Connect, they'll all be recorded for you. You can also switch from audio to video during a call. So if you're using the soft phone that we supply on the system, with a simple click on an icon, you can send a text message to the patient with a link for the video call. No extra apps are needed to be downloaded, and the patient can just click on the link, allow us to use the camera on their smartphone, and then begin the video call. Your audio call will automatically drop and the video call will be ringing on the screen in front of you. You can also use the system remotely. So you can log in to any phone in the practice and that will become your extension number. You can also log into Surgery Connect anywhere where you can access the internet, which means you can be working remotely as though you were in the practice, even using internal extension numbers, and patients wouldn't know any difference. So the main thing to think about is users and not phones. Currently in the practice, each room will have a different phone number allocated to a particular extension. But rather than the phones having the extensions, on Surgery Connect, it's the individual users that all have their own internal short dial number. And wherever you log in, those calls will be presenting to that particular device. We can also make those numbers direct dial, and again, those will follow you around no matter which device you're using. And there'll be groups set up on the system, so if you don't mind who you speak to in a particular team, you can call the group number rather than the individual's number, and that will go through to whoever's next available to take that call. And it doesn't matter where those calls end up. So if you're in the practice, there will be phones on the desk, and you can log into a desk phone and all your calls then will be presented through that particular phone. If you're working remotely though, you may choose to use the soft phone on the system, which is accessed through the user console. All your calls then will come directly through your PC or laptop, and you can pick the calls up via the soft phone app on the screen. You can also use a USB headset that way in order to interact with those calls.